So today our discussion will be about an AMI guide that we published last month, and this AMI guides are series of evidence-based best practices in medical education as part of the Medical Teacher Journal and published by AMI. AMI is the International Association for Health Professional Education. And this AMI guide titled Leadership as Catalyst for Advancing Social Accountability in Health Professional Education. We will discuss the overview of the guides and the key message for the guides, and also some international case studies from the guide. So this guide published by a group of educators from different countries. I led this team of the authorship, and then we have one of our colleagues, Dr. Mohamed. He was a previous care person and director of the Medical Education Center here, currently working in Limerick, and also Professor Erin Cameron, and she's working in North Ontario University, from Canada, and Dr. Shafiq is a dean and professor of North Texas University, USA, and Roger Strager is a dean and emeritus professor, North Ontario School of Medicine, also from Canada, and also David Tyler. He is a professor of medical education at the University of Liverpool, currently based in the UAE, working in Gulf Medical University, and finally Professor Lionel Thompson. He is the dean College of Faculty of Health Science, University. So a group of educators
now, lastly, and to mention,
if you can just use yourself.
How do we ensure that the nurses, they actually know how to implement this EMC?
Excuse me,
Basically,
can we all mute our
which
mics, please?
is the World Health Organization, certified facilitators, and they also underwent a pilot test.
Let me check if I can mute.
So it is a group of educators and leaders from US, Canada, and South Africa, and the Gulf region, and also from Ireland. And we met and we came with this product. So the outline of this presentation, we will begin first with clarifying the concept of social accountability. We have revisited before, but we will just refresh this concept of social accountability and discuss why it is so critical in our institutions. Then after that, we will highlight the importance role of leadership and how leaders at different levels can drive social accountability in a tangible way. Then after that, we will draw lessons from global case studies, including examples from different countries, and the leaderships of styles of their leaders, whether at institutional levels, health system level, to see how leadership actually catalyzes the change in various contexts. And finally, we'll share some insights, and also we would like to listen to your reflection and experience about how we can move forward on advancing social accountability at country level here, and how we can bring all stakeholders together in moving forward with this concept. So let me start by defining the social accountability, and I think most of you is familiar with the concept. Actually, the social accountability, according to the WHO definition endorsed by Charles Pauling and his colleague, defined as the obligation of medical school and health science school to direct education, research, and community service toward addressing the priority health concern of the community, the region, and the nation they serve. And identifying these community health problems and health priority, it is not a mandate only of the medical and health science school. It is a mandate of the stakeholders. They need to unite together to come with the identifying this health concern. But this need leadership from medical and health science school to move forward with identification of this health concern. And in a similar way, a social accountable health science school is the school that should focus everything, every day-to-day activity, everything it does, teaching students, conducting research, delivering service on the biggest health needs of the community and the society. And actually, these needs are not decided in isolation. They are identified jointly by working together as stakeholders from the community members, the patient, the policymakers, and the healthcare providers. And the expectation is that such institution or medical and health sciences school will produce a graduate who are able to support the community needs, who are generating research. And this type of research, actually, not for the sake of research, this type of research is to inform the policy and practice and to form a partnership that improve the health outcomes. So it means that our medical and health sciences school must always ask, are we truly meeting the health priority of the people we serve or not? This is a very important question that not only the leaders of the medical and health science school, this question should be asked by everyone involved in any teaching activity, any administrative support, any technical support. Are we truly meeting the health priority of the people that we should serve? When planning a lesson, when planning everything, this question should be a central question, and we should focus on. And as you can see here in the screen, this actually by partnership with the different stakeholders involved in serving our community. And actually, social accountability is very important because and we should care about the social accountability because there are for several reasons. First, it ensures that our health and medical schools, they stay relevant and they stay impactful, supporting the community. In a world of change health needs, especially social accountable health school and medical school, they should continuously adapt to address what matters most in the community, and we should keep and that keep us in a credible way regarding the public eye. The other second most important concept is that social accountability is very important about health equity by targeting community that need specific need. We should think about what are the real problems that we really want our future health professionals to study, to learn, and to solve the problem. And here the target is not only to producing a good physician or a good nurse and so on. No, the target here is to produce a health system change agents, that should not only work within the health system problems, they should fix the health system problems and advance the health system in a good way. And as you know, and particularly during COVID-19, we have faced a lot of challenges. And COVID-19 was a very hard lesson that we need to really to produce a type of graduates who really can support and fix the challenge that we are facing in the health system. So we should engage with our community to support community, to support graduates that will be able, inshallah, to solve all the problems that are faced by our community. And social accountability actually emerged from these four core values from the health care system, which is relevancy, quality, cost effectiveness, and equity. And the relevancy means that basically that we direct our teaching, research, and service to the actual problems and actual priority health needs in our community. For example, now we are facing problems related to non-communicable disease, or problems maybe related to mental health problem, or whatever the problem. Then our curriculum and the core curriculum should basically focus on this. Our student projects should focus on this. Our priority health concern in terms of the research should focus on this. And for the quality, that means we need to be committed to high quality based on centered care in training and in practice. And we should emphasize high quality in every day-to-day practice. And we should make sure that our graduates can provide comprehensive, compassionate, and really meet the community needs. Regarding the cost effectiveness, that means we need to train the graduates to use the resource effectively, and considering this in our educational institutes. And for the equity, we should work with our stakeholders and educate our graduates to support promoting fair access to health services for all people that we serve. And in order to achieve this, we have presented in the guide the social accountability dynamics. So this social accountability dynamics start with the social accountable health professional education. And the process starts with our educational institute, where we should work in producing the graduates who can understand the social accountable. And then those graduates are trained to meet the health needs. And this also has integration with the health, social accountable healthcare services delivery institutions and the workplace where the graduate practice. They can apply the social accountability in real settings, and their action strengthens the service delivery that align with the community needs, as you can see here in the screen. And the third tier here, we need to have like equity-oriented social accountable healthcare system focus on local population needs. So like there should be some interaction and integration between the schools, between the service professions, and also the health system need delivery and so on. And in order to have this in a clear way, we need to really understand the relationship and this important dynamics between the education system and the health system. And as you can see here, population defines the starting and ending points, because both education and healthcare system, they are serving the populations. And the needs of population actually drive demand for both, for the education and for the healthcare system. And these same needs inform which type of health workforce we need to develop. And the health system responds to these needs by provision of the services, and it provides again feedback to the education system and so on. And the labor market determine the needs from both education and healthcare systems. So the key message behind these slides, we need to close or to bridge any gaps between both systems. And we need to work together in a partnership to identify these gaps and these issues in the healthcare system. And actually, we have identified in the researchers many gaps that, despite of the concept of social accountability that started early in 1995, still the concept is not operationalized in the medical and health science school. So many institutions actually they struggle to turn social accountability idea into practice. And although they made effort in making social accountability as part of their missions and as part of their effort, they are still suffering not to translate it to this. And one of the key reasons is the gap of leadership. And we found that in the research, very few health science and medical schools, they invest in developing leaders who are capable of driving social accountability. And we'll explore some experience from Canada and other countries in which leaders could manage to advance the concepts. And we found that also leadership development is often fragmented or even neglected. And we found that even where leadership program exists, they might focus basically on training people about the administrative and management and such issues, with isolations in connection or in connecting between the leadership and supporting the communities. So we found that we have been, although of this training, it doesn't really say focus on the needs of the community and so on. So moreover, there is no documented good practice, or let's say lack of clear framework and tools that can guide the process or the principles of social accountability in health professional education. This results in that social accountability overly stay at maybe the level of the vision, the level of the missions, or maybe a box to be ticked for the strategic plan, or for like just at the level of papers, but not really reflect on action. So for this reason, we thought about writing this AMI guide that can help the leaders of the universities, the chancellors, the deans, and also the leaders of the health system, so that they can advance supporting this concept. And let us begin with the central concept of this AMI guide, which is leadership as catalyst for advancing the social accountability in medical education. And let us explain what do we mean by that. Simply, we mean that to put great attention, or putting great attention actually is not enough. And having good intention towards serving the community, this is not enough. We need effective leaders who can transmit these concepts and advance these concepts.
الايميل حقي
And committed leaders
قلت لي الشاحن انت انا عارفه لك شاحنه وين
can just please can mute yourself, please.
خليك على توطي الصوت هاي بس في ناس تحيل الايميل حقي كده تعال
Can you
لو سمحتي رحاب
تحيل اي رحاب كرارة hotmail.com.
excuse me رحاب can you mute your mic please
هاي بيكون
so a committed leaders can align.
لو سمحتي رحاب الله يرضى عليك احنا في سيشن just mute your
حاضر ده الموبايل عاوز اقفل الموبايل واشغل اللابتوب
بس زي سكري
حاضر
محمد الله يخليك عندك البارتيسيبنتس انا ميوت
معليش انا ما
Okay, so a committed leaders can align those concepts and advancing these concepts and moving forward. And we have identified these important 3 levels of leadership that should be considered really by the policymakers in advancing these concepts. And actually, it is multiple levels. The first levels of leadership that we should pay attention to as educators and policymakers makers as individual levels. So we need actually to train our people with the right competencies and mindset. And this means that we need to identify and developing individuals, whether they are in the leadership roles, these department chairs, faculty, students, leaders, who are committed and trained to drive social accountability. And this AMI guide focuses on the importance of selecting the right person in the right place. For example, faculty members who are skilled in community engagement can be empowered to lead initiatives related to community engagement. And these individual faculty members and leaders, change agents, can inspire the others and build new ideas. And this is at individual level. Where at institutional level, leadership is about putting the place and structure, the process of social accountability into the education system. For example, we have found that in most of the Canadian universities, there is a position for the assistant dean for social accountability. And in some organizational structures, we found that there is an office of social accountability. And the main purpose of this office is to develop and to adapt policies. And these policies actually facilitate the work of the university in terms of linking admission criteria to recruit students maybe from underserved populations, or to recruit students who can serve the population, and so on. And also, so this related to the mechanism. And the system level, we need to work with the stakeholder in order to support the social accountability at country level. We need to work with the Ministry of Health and the other related stakeholders, how we can advance the concept. Because again, the main aim of the medical and health professional education is not only to graduate a good doctors, a good nurse, a good physiotherapist. No, we have a responsibility and we have a social obligation toward the community that we should serve. And I like actually this quote that physicians and healthcare professionals must not only just fix into broken system. They must change this broken system and support them. So this is very important key message here. Now we have also explored what are the suitable leadership models that can promote social accountability. And the AMI guide highlighted several leadership models related to this. And these leadership models, we focus basically on four: transformational leadership, adaptive leadership, servant leadership, and collaborative leadership. And if we look at the different leadership models and the leadership in the literature, we will find that these models are relevant to the education system and to the healthcare system, because transformational leaders are leaders who can inspire and share visions and drive systemic change rather than maintaining the status quo. While adaptive leaders, those quality of people, they are responsive and they are collaborative. And it's very important in a complex situation, such as the health system. And nowadays, we have an evolving role of graduates, evolving role of educations, many challenges of the health system, and so on. And in order to manage this effectively, we need such style with leadership. Also, the servant leadership models, which is another like flipping of the traditional models. These leaders put to serve the others, and we need a humble leader who can just approach the community, sit with the community, identify the community needs in a great way. And this is very important quality of leadership that really manage to foster social accountability globally. And also collaborative leadership styles, which is basically about partnership and shared power, given that because social accountability requires working with the community, health services, governments. So we need such, we advocate for such collaborative leaders, and they are the ones who create collation and cross sectors and help people to communicate with the stakeholders. Now we'll go through different case studies. One of the very good medical schools and health sciences schools, and we will explore how leadership in countries such as Canada advance really the social accountability at institutional level as well as country level. Know some medical school or school of medicine, we found that after analysis of the leadership style, most of the leaders they apply the transformational leaderships where they are combining the vision of serving rural and indigenous community in Canada, and they embed the social accountability in the core function of the medical school. They have designed their curriculum as co-designed curriculum, and the co-designed curriculum that is co-created with the leaders from the community leaders. So the curriculum is not only developed internally with the faculty member. The curriculum developed, co-created as a distributed engaged learning model. They name it DCEL with the community partners, and they send their students to be trained in more than 90 rural areas, and they align their curriculum with the needs and so on. So these transformational leadership styles actually support in identifying the needs of the community. They have changed their admissions to be tailored to these community needs, and they also institutionalize social accountability by establishing center of the social accountability. And also, they embedded their medical school to be well networked with the health system, featuring the research, working in identifying the research needs with the healthcare system and so on. And their governance also include community voice in table, not only at the level of advisory board. They have like equal partners in managing the curriculum, supporting the curriculum, and for example, the community representative in this some medical school, they have to decide where the learner to be placed, which type of research should be conducted, and so on. So this example of one medical school adapted through leadership, they managed to advance social accountability. We have also visited and in the literature another school from the region. We have found, and this is one of the leading school in advancing social accountability, University of Jazeera, and they are using like community-based and community-oriented medical program where they are using the interdisciplinary field research and training. And the curriculum and the college actually built by the Professor Basir Hamad, who integrate the culture of community-oriented medical educations, and the governance and structure of the medical school is closely related to the health system. And they are taking decisions in advancing the curriculum, mobilizing the curriculum, and so on. And even during the challenge time, we have analyzed the interventions made by this medical school in fragile context and armed conflict, and they managed to support the community that they serve through education, research, and community service, which is considered as strong, resilient medical school that follow leadership role in advancing medical education during fragile context. And I think you can find, when you read the AMI guide, you will find detailed experience about each of these medical schools. The other experience that we are sharing, medical school from Philippines, and where they apply the servant leadership style. And in this medical school, it is Ateneo Zamboanga Medical School or University in Philippines. They illustrate the servant leadership in action. And this medical school established with the clear goal to serve underserved populations, and in which they are serving many rural countries and where there is no doctors and there is no healthcare providers. And we found they reported in the retention that the leadership asked, what does our community need and how we can serve the community? And they apply this through difference of initiative, starting from recruiting the students, moving forward to have like a dual degree program, such as having MD, MBH at the same time, so that to equip the graduates with both the clinical expertise as well as to produce public health leaders. And statistics show that they have improved the population health that they serve in Philippines by having this dual degree. Also, they work in having collaborative project with the community, and they form strong partnership with the local education, the health care system, and so on. And having this product or programs as co-ownership with their community, and finally they manage to support their community. Another very good experience from Australia, also reported in this AMI guide, including this University of Flinders in Australia, where they work in like having like parallel curriculums, example of collaborative leadership, and the program was co-designed with the rural community and so on. If we look at these 4 case studies that is presented in this AMI guide, we find that the transformative leadership, the servant leadership, the collaborative leadership, and the adaptive leadership is the core leadership that has been models that has been examined in this 4 areas. And I'd like also to stop here and we need as educators to revisit the metrics that by which we are assessing the qualities of our medical and health sciences school and the universities. And we need to redefine the excellence. What do you mean by excellent university? What do you mean by excellent medical and health sciences school? And we do believe that excellence must be measured in societal impact. To what extent we are doing impact in our community. So we also explore, in order to integrate leadership in universities, in order to advance social accountability, we need to think about the different models. There is no single model that could be followed. So, for example, maybe a dean might be transformational leadership in setting the vision, adaptive when navigating any crisis or challenge, servant when prioritizing the marginalized group, collaborative when building this partnership. So it's all in one role. And also we need to think about this leadership in micro, meso, and macro level. In micro level at the community, we need a lot of leaders who facilitate community-driven decision, education and service delivery. And this could mean that involving the community representative in the curriculum and health interventions. And at the institutional level, we need quality of leaders who coordinate and align with the stakeholders within the school, within the regional partners, within the regional NGO to embed the social accountability in practice. At macro level, we need quality of leaders act as champions for system dynamic, work to advocate accreditation standards that foster social accountability, funding models, and so on. So we need, first of all, blending style of leadership. Then we need to think about the leadership qualities at different level, at micro level, meso level, and at macro level. And this quality actually is needed for many things, for strategic vision. And this means that we need to have having a forward-looking perspective in the community. And strategic leaders is the one who can set the direction and work closely to anticipate the community need. We need also leaders with ethical integrity, and we advocate for that, who are committed to transparent, fair decisions aimed at community benefits and building trust with the community. We need with a collaborative spirit, skills in engaging diverse through the shared decision, and we need adaptive and innovative mindset. And this also needs some sort of humility and reflexivity in terms of a mindset of open listening and having self-awareness, because social accountability leaders should value all voices, especially those community members and students, and acknowledge they don't have all answers. This is very important to show humbleness, and they need to keep the community well engaged. With good, effective communications, aiming at clearly articulate goals, progress, and success, with mentorship and building capacity, such as developing other leaders within the organization, so that they can create structured mentorship program toward serving the community and serving the next generations. So also you need quality of leaders who are evidence-driving disciplines with the commitment to data-informed decisions making and follow thoroughly, so this they can really work in measuring the impact. This is very important quality of it. So we also discussed in the AIME guide key strategies for the leaders to advance social accountability, like the co-creation program, inclusive engagement, designing and enabling structures, and investment in the leadership system. The AIME guide also explored the Canadian experience, and as we can see here, the first WHO report of social accountability started in 1995, and then in 2010 they came with the Canadian vision of medical school, and then they have created a network, Association of Medical Schools, Faculty of Medicine in Canada, and with the vision to advance the social accountability at country level. Then after that, they came with the report in 2012. And they found that it will be very difficult to move forward with the concept of social accountability unless it needs to be supported by the accrediting bodies, so that they revisit the accreditation standards, and they have shifted their accreditation standard from process-based to outcome-based, and then they really instill and embed social accountability in their accreditation practice. So that they came with another support and so on, and now they are moving forward with advancing this. And at operational level, they work in the field of education, research, and health and community services, and they have done this change at the curriculum, admission, learning environment, in research. They have done work in setting the research agenda in alignment with the community needs, conduct and ethics and dissemination. Not only this, also they work on advancing the concept in the clinical training and so on. So also you will find this details table in the guide. Now we will come to the end of the session and the take-home message from this AIME guide. So we emphasize that leadership is the engine that true turn social accountability from aspiration to reality. Good intention will not move the medical school to be social accountable to support the community. We also advocate for effective value-driven leadership, and the future of social accountable medical education basically depends on the leadership. Unless we invest on leadership training in advancing social accountability of health professional education school, our community will suffer from having problems that will not be solved by us. Again, social accountability is not someone else's job. It's not a community role. It's not a community service office. No, social accountability is a mandate for everyone in the university, everyone. So that we need to, as a leaders, to work as a deans, at the care department, chancellors, we need to work on advancing this concept to move forward. The main aim, as Dr. Al-Amoud said from the beginning, the main aim of this publication forum, we need to call for action after each publication forum, because it's not only about sharing what we publish, we need to use insights and strategies that we discussed today to inspire action in our context. And we need to start actually the key message. Each program, each medical program, we need you to think about how we can improve the population health of our community as a nurse, as a physiotherapy, as medical imaging, and so on. And alhamdulillah, through the Social Accountability Committee, we started, and we start working with our colleagues from the medical imaging program, and now we are working in a project in advancing social accountability in radiography education, and we are working also with other programs from the College of Health Science, and they show a high commitment with the physiotherapy and the College of Pharmacy and so on.